Welcome. My name is Professor Tilz. I'm the director of the Department of Rhythmology at the University Hospital in Lübeck. I'm glad to present the results of the international POTTER study. The rationale behind this international registry was to evaluate the incidence, the management, and the outcome of atrio-oesophageal fistula formation post-AF ablation. Esophageal fistula formation is a very rare but highly lethal complication following AF ablation. It is an international retrospective survey. In total, more than 200 centers participated in this study from 35 countries worldwide. So it's a true worldwide survey. In total, 138 patients were enrolled in this study. In this survey, more than 500,000 of patients were treated in more than 200 institutions out of 35 countries. Out of these more than 500,000 patients, 138 patients had an esophageal fistula formation. The key finding of this study were the following. Number one, the incidence of esophageal fistula formation post-AF ablation is 0.025%. This means 25 out of 100,000 patients get an esophageal fistula. It appears to be a pure RF problem because 38 out of 100,000 patients treated with RF got an esophageal fistula formation, whereas only 15 out of 1,000,000 patients treated with cryoablation suffered from an atrio-oesophageal fistula. Second, it is very important that you look for these complications and treat them aggressively. You can diagnose the fistula with the CT in over 80% of patients. If you do not treat the patients, the mortality is 80%. If you do not treat the patients, so if you treat them conservatively, the mortality rate is almost 90%. Whereas if you treat the fistula either with surgery or with stenting, the mortality rate is just about 50%. Third, you have to be aware of the complications. If you find it, treat it early. And number four, maybe RF energy is not the right energy to treat patients because it appears to be a pure RF problem. Cryo energy and pulse field ablation energy appear to be much safer with regards to esophageal fistula formation. So these findings have a huge implication on my daily practice. Number one, awareness is very important. So we have to be aware of this complication. And once a patient is complaining of dysphagia, fever, neurological deficit after AF ablation, you have to do a CT scan to look whether the patient has any evidence of esophageal injury. Second, you have to treat it aggressively because if you do wait and treat it conservatively, the mortality rate is more than 90%. Treat it early. Third, reconsider your energy of choice. This appears to be a pure RF problem, so other energy sources like cryo or pulse field ablation are associated with a much lower incidence.